take off from the news corner in Kaduna State, where patients and their family members are bearing the brunt of an indefinite strike embarked upon by the state chapter of the Joint Health Sector Unions, JOHESU. Healthcare activities have been paralyzed in all the government-owned hospitals across the state. The workers' unions, comprising of nurses, pharmacists and other administrative staff, began an indefinite strike on the 1st of March in protest against government's failure to pay their outstanding 30% consolidated health salary structure agreement signed 2 years ago with the state government. A meeting held between the aggrieved workers and representatives of the state government on Monday, March 3rd, was inconclusive. The State Commissioner for Health explained that the government cannot yield to the workers' demands at the moment and appealed to them to be patient.
We have implemented 70% of what they are demanding. It's the balance of the 30%. Of course, it's because of the poor finances of the state. That is why we've not been able to implement this 100% as required by them.
Some of the hospitals visited within the metropolis were almost deserted. The medical director of Yusuf Dantosho Memorial Hospital, Todunwada, Dr. Muhammad Amiyao, said the strike has forced the hospital to discharge many patients except a few critical cases.
Affected a lot in the hospital because doctors cannot function entirely on their own. It's a complex process in the hospital. You need each other to complement the services. So it's not just about doctors. But the doctors are not on the strike. Normally they come in, but naturally you have limitations because even to get the cards of the patients is difficult. And then you don't have the nurses even for the medications. You don't have the attendants to clean the place. And naturally the nurses have so many different faculties, like from pediatrics to the maternity to the labor room. So these are a lot of logistical nightmares because the hospital cannot function by doctors.
The few patients on admission narrate the effect of the strike on them.
Last week I was supposed to be operated because I have a fracture here. So I was not operated last week. So before they went to the strike. So they should come to conclusion and let the workers come back to work so that I can get operated because I've stayed long.
As at the time of this report, the government is meeting with leaders of the Health Workers Union with the hope that the strike will be suspended as soon as possible. Straight on to South Nigeria, where women from the 18 local government areas in Edo State converged on the festival hall of the government house to avail themselves of breast cancer testing kits donated by the state government. The senior special advisor to the governor on special duties and emergencies, Mrs. Maimuna Momodu, while educating the women on breast cancer prevention, advised them to desist from smoking, excessive alcohol, and engage in regular physical exercise, as early detection is key for cancer survival.
Recently, we keep hearing that this Mrs. A died of breast cancer, this one died of cervical cancer and all that. And we've been told that early detection is the key to surviving breast cancer. And so we now feel that, okay, if we have this self-examination kit, perhaps that will reduce the rate at which our women are dying. And that is why the state government did it fit to give out these things to them so that we'll be able to save our women from untimely death as a result of breast cancer.
In East Africa, the World Bank has frozen a loan worth $90 million meant for Uganda's health service as it wants to ensure the country's new anti-homosexuality law does not harm projects the loan is supposed to support. Kampala has branded the decision intimidating. The move came after the Ugandan president signed an anti-gay bill last week. Uganda said the World Bank's move is a huge embarrassment and it won't be intimidated into reconsidering the anti-gay law.
Africa has been in engagement with the Western world for the last 2 centuries. How come the only thing Africa has reaped is poverty and misery? So the withdrawal of aid could be a blessing in disguise.
Uganda heavily relies on donor aid, but after the public signing of the controversial bill, President Yoweri Museveni assured donors that his country could live without aid from the West.
It is an attempted blackmail which the Western world has employed on Africans for the last 2 centuries, and I think Uganda is leading the way to stand up to this blackmail.
The law that punishes homosexuality has been widely criticized by the international community, but celebrated by many locals in Uganda. We move on to South America, where for the past few weeks, severe flooding in northern Bolivia has killed livestock and plagued farming communities, now struggling for food and worried about thousands of children. The rotten cattle are going nowhere, and the stagnant waters are becoming increasingly contaminated. This doctor worries about the children who do not know better and are still drinking the water. The water, as we know, is contaminated and is full of trash. That is why it is contaminated now. The water level is beginning to drop, and the children don't understand that the water is contaminated and it is not good. We explain that, but they still go into the water and drink. The United Nations says some 77,000 Bolivian children have been affected by the flooding. Doctors say they have seen an increase in waterborne illness and are trying to educate children about the dangers of consuming it. With schools and playgrounds deep under dirty waters, many have moved out of their homes and are living out of makeshift boats. UNICEF plans to send aid targeting children, which includes medicine and mobile schools. Finally, having a hot temper may increase your risk of having a heart attack or stroke, and that's according to the Harvard School of Public Health researchers. Rage often precedes an attack and may be the trigger, say the U.S. researchers. People who have existing factors, such as a history of heart disease, are particularly susceptible. The data from 9 studies and involving thousands of people suggests that in 2 hours immediately after an angry outburst, risk of a heart attack increased nearly 5-fold and risk of stroke increased more than 3-fold. The researchers calculate that 5 episodes of anger a day could result in around 158 extra heart attacks per 10,000 people with a low cardiovascular risk per year, increasing to about 657 extra heart attacks per 10,000 people among those with a high cardiovascular risk. The risk is cumulative, meaning temper-prone individuals will be at higher risk, but they say more work is needed to understand the link and find out if stress-busting strategies could avoid such complications. Experts know that chronic stress can contribute to heart disease, partly because it can raise blood pressure, but also because people may deal with stress in unhealthy ways, for instance, by smoking or drinking too much alcohol. Just before we go, I would like to acknowledge the message sent in by Adeleye Olabanji from Chevron Clinic, Escravos, on last week's edition of Health News. Adeleye, who is a nurse, is concerned about the nurses whom he said have been deprived of their rightful place for so long. Here is a quote from Adeleye's message. It reads, "Most nurses today are degree holders, yet they are relegated as if they are aliens in the health sector. I think government should implement the Industrial Arbitration Panel Award now." Thank you, Adeleye, for that feedback. We'd also like to feel your pulse on these or other editions of Health News. Send your thoughts to healthnews@channelstv.com or send a message to 081-864-38129. And we can also expand the conversation on Twitter at Yomi_Otaigbe. Thank you for watching. I'm Yomi Otaigbe.